The Autism Society of North Carolina presents Before the Diagnosis: What I Should Know About Autism. Thank you for joining this webinar. It's designed for families, caregivers, and self advocates to learn more about autism so that they can find help for their loved one who might be on the autism spectrum. This webinar was created by Wanda Curley, a retired autism resource specialist with the Autism Society of North Carolina. I'm Nancy Nestor, and I'm also a retired autism resource specialist with the Autism Society of North Carolina. Both Mrs. Curley and I have adult sons with autism, so we understand the realities that you're facing, as well as the feelings you may be having. We both have been in your shoes. So let's get started by reviewing what we will cover today. I'm going to define autism spectrum disorder. I will give you some of the early signs of autism and talk about how it's diagnosed. And then I'm going to share some wonderful resources with you. What is autism spectrum disorder? It's a neurobiological disorder of development, and it causes differences in the way that information is processed. This affects a person's ability to understand and use language to communicate. They react to people, events, and objects differently. They also have a different reaction to sensory stimuli, and they don't think and learn the same way as a typically developing person. Autism spectrum disorder affects individuals with varying degrees of severity, and it's a very complex condition. And that's why no two individuals are the same. It's a lifelong developmental disability, and it usually appears during the early years of childhood. However, someone could be diagnosed at at any age. For a detailed information on the core features of autism, you can click on the link on this slide, or you can go to the Autism Society's website, click on Gain Knowledge, then click on the webinar library under the Learn With Us tab, and then click on Autism 101. Autism is about the way information is processed. So let's take a deeper look at that. Differences in how a person processes information is a core feature of autism. It accounts for the variability of autistic characteristics seen by others, and that's why no two people are totally alike with autism. Each person will have their own set of communication strengths and deficits. Their socialization needs will be different, sensory difficulties, and their thinking will also be different. These characteristics may appear differently across settings as well, depending on the person's comfort level with the situation. Because children are born with autism, it's important to know the patterns of autism onset that are typically seen. So, developmental skill for a toddler with autism will likely follow one of the patterns described on this slide. In the first pattern, parents notice differences in development, and there are global delays before the child turns 1 or before they turn a year and a half. In the second pattern, a child's development may be slow or it may be on time. However, when a child reaches a certain developmental stage, the growth seems to just stall. For example, a child might begin babbling and speaking on time, saying a few words, but then they never increase their vocabulary and they never string words together in a meaningful way. In a third pattern, children begin normally, and then when they reach about their first birthday, between the first and second birthday, they start losing the skills that they once had. Before delving into the differences commonly seen, let's talk about the prevalence of ASD. You may be interested to know that the current rate of autism nationwide is 1 children in every 36 births. Autism spectrum disorder knows no racial, ethnic, social, and economic boundaries. So family income, lifestyle, and educational levels don't affect the chance of a child being born with autism. ASD is 4 times more prevalent in males than females, And overall, the incidence of ASD is consistent worldwide, although it's increased dramatically over the past 25 years. So, if you feel your loved one may be on the autism spectrum, you may want to know the common signs of autism. And that's the focus of the next 4 slides. Please know that a person may exhibit many of these differences, or they may exhibit only a few. So, a common social and communication deficit that families often see is a child or a teen who avoids eye contact. Another one is not showing interest in other people or sharing events with other people. That's called joint attention. So, joint attention is the ability to purposefully join in and share an experience with someone who's trying to interact. Some people with autism seem like they're in their own little world because they lack that ability of joint attention. Appearing not to hear when others speak to you. That's also very common. A lot of parents will have their toddlers hearing checked because they think that they're having some sort of issue with hearing, only to find out that there's not a problem, and really it's autism. Not showing emotion or understanding how to interact with others. Perhaps showing the wrong emotion for a situation. Maybe always smiling or always frowning. Or maybe they're smiling and laughing in a situation where they should be sad. No use of gestures or pointing to communicate. That's another example of joint attention. Delayed speech, not speaking at all, or only having 3 words at the age of 2. By the age of 2.5, a child should have 50 words and be able to string 2 to 3 words together meaningfully. So if you're not sure of the age appropriate developmental milestones, you can use the resources that I list later in this webinar, or you can talk to your child's pediatrician. Many children have a very flat tone when they talk. It's very monotone. There's no inflections up or down. Or they may have a sing-song kind of language where they talk, they go up and down with the same cadence and the same change in pitch. Many of our kids prefer solitary or parallel play when engaging in play with other children. So, parallel play is when children play beside each other, but they don't interact. Interest in interaction in children typically begins between the ages of 3 and 4. And we know that situations can impact that development. For example, an only child who never leaves the house may not develop as quickly as a child with siblings, brothers and sisters, or a child who goes to daycare. Preference for structured play over spontaneous or pretend play. So, a child with this sort of issue might line up their toys rather than having their toys interact with each other. And if they do have some play that looks imaginary, it's usually the same scenario over and over again. Dolly has broken her arm and I need to put a bandage on it. A little boy drives his car down the track, but he never interacts with any of the other cars that are on the track. It's always the same thing over and over again. Differences in thinking and learning. Loss of a skill that an individual once had. I mentioned that when I was talking about the different onset patterns. A child may stop saying words that they once used. Think of everything in concrete patterns. So concrete means that they take everything literally. Most people develop the ability to think abstractly between the ages of 12 and 14. So for a toddler, this may be something hard to pick up on, but a teen might not understand idioms like over the moon or out in left field or it's black and white. They might not understand sarcasm either. Some of our kids focus acutely on details and they lack that ability to see the big picture. For example, my son was obsessed with different colors when he was young, and he would often attribute an action that occurred because of his toy's color rather than another factor that might be at play. My son would say something like, red car broken, white car. If it was blue car, it would not be broken, when really it was just the red car was older or he had played with it a little bit roughly. Another thing is that many of our kids have possible attention issues. They're easily distracted by their environment. I'd like you to realize, though, that this issue in and of itself is not necessarily a sign of autism, although children with autism commonly have attention issues. Our kids tend to be very visual learners. They remember what they see much easier than what they hear. And in fact, auditory memory, that auditory sense, is usually the most underdeveloped. They have difficulty putting things in sequence, steps, and they have a hard time expressing themselves with ideas. And some of that is that sequencing issue. They can't retell events because it's hard for them to realize what they need to say went first, second, third, and so on. You may see some unusual behaviors and interests. They may be interested in certain objects or subjects. I know very common for our kids to be interested in spinning things when they're little. They like to spin themselves. They like fans. They like wheels turning. They like trains. Some children like dinosaurs. For some of our kids, it's just a very specific topic that catches their attention. Some of our kids show more interest in objects than people. I have a friend whose daughter, when she was little, she was obsessed with jewelry, and she would go up to a strange woman who was sitting down, crawl in her lap, and start playing with her earrings as if the woman was not even there. So, sometimes they are more interested in objects than people. They may get upset when the environment changes and the change in routine. I've known people who've said one of the first things they noted with their child was if they ever went a different way home from the store, the child got upset. I know in our house, we got new furniture, and my son really had a hard time with that. He wanted the old couch. He didn't want the new couch. We got a new car, and he put an out of order sign on it because he wanted the old car back. Sometimes you see repetitive movements such as flapping hands, rocking back and forth, or repeating the same sounds over and again, or the same words over and over again. And that's called stimming. It's a common word in the autism world. You may see a child laugh or cry for no specific reason at all. That's a common sign of autism. Sensory issues are quite common for folks with autism, either hypo, which means under, or hyper, over sensitive to our senses, sight, sound, smell, taste, and touch. A child may cover their ears because they can't handle loud noises, or maybe they hear something long before you do, but yet they may not feel pain. They may be bleeding and they don't realize they're even injured. So these sorts of things are very unique, and every child will have their own personal sensitivities. A child may exhibit some motor skill delay. So they may be physically uncoordinated and have problems with balance. You may also have a child who's very good at running and maneuvering and using their arms to climb, but they may struggle with fine motor tasks like picking up small objects or buttoning buttons, zipping zippers, tying their shoes. Very common. Many of our children also have proprioceptive issues, which is body awareness. So a child with body awareness issues may crash into people or things because they don't realize where they are in space. They may use too much pressure or too little pressure when touching things. So they may pick up something and it may slip right through their hands because they're not grasping tightly enough, or they may break it because they grasp too hard. It's important to note that not all individuals with sensory differences will have a diagnosis of autism. Early detection and intervention. So early intervention is key. We know that children who have been diagnosed and get early intervention have a higher quality of life and they function much easier. The reason why that happens is because parents and teachers, caregivers have the information they need in order to provide the child with different tools and strategies so they can be successful. So, if you've noticed any of the behaviors just listed, it's important that you take the next steps to get help for your child. And that's getting a diagnosis, which is our third objective for today. ASD is not diagnosed through medical tests. There's no blood test. There's no battery of physical movements that will be done, no x-rays. It's done by accurate autism diagnostic testing. It's a battery of tests and a series of observations done by a team of multidisciplinary people, maybe clinical psychologist, psychiatrist, or neurologist. And those tests are based on the criteria found in the American Psychiatric Association's 5th Diagnostic and Statistical Manual of Mental Disorders. The 5th edition was created in 2013. And back when we used the DSM-4, we had separate diagnoses of autism, Asperger's, and PDNOS. But when the fifth edition was created, they decided that all of those conditions were similar enough. So they just moved them into one specific diagnosis. I will tell you that schools quite often will classify a child as having autism so that they can receive special education services or accommodations. But if you're wanting to get state services or if you're wanting therapies paid for by insurance, you will have to go beyond that school diagnosis and get a medical diagnosis. Sometimes schools can provide some of the testing that needs to be done, but there's more to it than that. So if you'd like to learn more about diagnostic criteria, you can click on the link on this page, or you can go to the Autism Society website and click on the Gain Knowledge tab, and then look under Autism 101. So if you're concerned that your child may have autism, you want to make an appointment with your child's pediatrician to talk about your concerns. Depending on your child's age, their doctor may do a screening called the Modified Checklist for Autism in Toddlers, MCHAT. And that's a validated developmental screening tool for toddlers between the ages of 16 and 30 months. It's designed to show whether or not a child might benefit from a thorough evaluation for autism or other developmental disabilities. So if your child scores at risk, then the pediatrician will assist you in making referral for further testing with a child psychologist, a psychiatrist, neurologist, or a local company that can provide the testing. They may also connect you with the Children's Developmental Service Agency, the CDSA, if your child is young enough. So the CDSA works with children who are under the age of 3. You can contact the CDSA. You don't have to wait for a doctor's referral. The CDSA is a local agency. It's part of the North Carolina Infant Toddler Program. And what they do is they provide services to children, such as speech therapy, occupational therapy, play therapy, but they also coach parents on different strategies that they can use to help their child develop the skills they need. This is part of the North Carolina Division of Public Health. And you can find your CDSA and make a referral for your child through either of the two websites listed on this slide. Please know that no one will be turned away because of inability to pay. If your child is 3 years old or older, you can always contact your public school system. Even if your child is not involved in a pre-K program through your school, you can contact your local elementary school or your Board of Education and ask them to help you find someone to evaluate your child. If your child's already in school, you want to talk to your child's teacher or the principal, and you want to request an evaluation in writing so that you have a timestamp for your request. It's important for you to know that not every child with autism needs special education, and that's kind of what you're asking for, nor will they be eligible. There are many folks with autism who never ever need special education. However, if they have social emotional skill deficits or language deficits, if they struggle to communicate with peers, or if they have adaptive life skills, for example, if they struggle with handwriting, zipping zippers as a toddler, as a kindergartner, tying their shoes, putting their coat on away or putting their coat on, dressing, things like that. You can ask for testing to be done for occupational therapy or for speech, and that can be done as a related service if your child qualifies. The other thing I want you to know is because this program is federally mandated, children are provided these services free of charge. So sometimes children are not diagnosed until later, and usually the key factor that comes into play is the difficulty they have with socialization. They may have a really hard time initiating a conversation or just taking part in a conversation. And they may do fine with adults, but they may struggle with kids their own age. They may have trouble making and keeping friends, and it's because they don't know how to read body language or others' emotions. They oftentimes have restricted interest, and it may be something that other kids their age are just not interested in. It could be something that a younger child might be interested in, or it may be something that a much older person would be interested in. They're easily confused by language. They take things too literally. They have a hard time with idioms and sarcasm, and you probably would see this more as a child reaches the middle school ages. The other thing that may happen is they may have a really broad vocabulary, and when talking, they may sound more like an adult. And so peers their age are not able to relate to them. In spite of all of this, they may have trouble following multi-step directions and have trouble with organizational skills. So they may have trouble with things like keeping their room straight, hanging on to assignments and getting them turned in. Their notebook may look like an atomic bomb went off. They may lose their coat, their shoes, their mittens, their cell phone. Hanging on to things can be difficult for them. They have a hard time understanding other people's perspectives unless they have been through that situation themselves. And some of our folks also have a hard time respecting people's personal space. They may get too close to someone when they want to talk to them. And because of all these social rejection situations that come up for them, they may feel very frustrated. They may have a lot of anxiety and depression. There may be some situations where they really just want to avoid school altogether. They want to avoid social situations. So if you're the parent of an older child in older elementary, middle school, high school, I want you to not be hard on yourself because it is very difficult sometimes to diagnose an older child with autism. Part of the reason is they may do well in school. And if a child is doing well in the school, the teachers are probably not going to contact you and say, I've noticed that your child is struggling to interact with other kids. Um, the other thing is your child may do great until they're in a new social situation, like if they go to middle school from elementary school, or they go to high school, or you move to a new town. All of those social changes may just become so overwhelming that the autistic characteristics start coming out. So again, if you have these concerns for your older child, please reach out to your doctor, and your doctor can probably tell you places that diagnose autism, but do know that a lot of times the places that diagnose autism for older children want to rule out other things before they start thinking about autism. So if you're an adult on the spectrum, or you suspect you're on the spectrum as an adult, I want you to reach out to your autism resource specialist or your doctor and ask who can provide diagnostic testing. Many times we will have places that diagnose children, but there are not as many places that diagnose adults. So you really may need some help finding a place. Once you get that diagnosis, reach out to the support systems in your community, because they can help you build kind of like a network, a safety net. We want you to remember your unique strengths and your challenges. You, as an adult, if you're just getting diagnosed, you have a lot of really strong skills that have helped you get this far. So when if you decide to talk to a therapist, they're going to want to know what sort of issues you're having. So you need to be able to identify those challenges, but also realize that you've got strengths that have helped you in the past. And with the help of a therapist, you may be able to tweak some of those strategies and use them for your challenges. If you have any other overlapping conditions, either medical or mental health, you need to identify those and get those dealt with, so that when you go to get help for your autism, that's the only thing you're dealing with. It's really hard to get help for two or three conditions along with autism. And we know that medicine is very helpful for many conditions. We want you to learn all you can about autism spectrum disorder, and also any appropriate treatment options. Unfortunately, there's lots of information on the internet, and sometimes that information is not helpful for you in your own specific situation. Remember that you're not alone, and a diagnosis of autism does not define who you are. So the Autism Society North Carolina has a good resource for adults. This is a blog that we have with frequently asked questions for adults looking for a diagnosis. This blog is going to help you prepare for your appointment when you ask your doctor for a referral. It's going to help you look at treatment options and ways to ready yourself moving forward. So you can click on this link and it'll take you right to the place on the website, or you can go to the Autism Society webpage, click on Gain Knowledge tab, and then click on the blog on links under the Learn Online tab. While you wait, it's going to take a while to get a medical diagnosis. It could take 9 months, it could take a year in some places, it could take more. And so while you wait, it's important to think about other things that you could be getting help with. And your doctor can provide you referrals for therapeutic practices that can help with the skills you need. So, if the doctor feels like your child needs um, speech therapy for pragmatics or social skills, you don't need an autism diagnosis to get help for that. Same thing with occupational therapy if they need help with motor skills. So if your child needs ABA therapy, that is a therapy that you have to have a medical diagnosis for. You could get on wait lists, and some ABA companies will do the testing to get that um, medical diagnosis. You want to research any supports locally so that you can create a network of support, but also online, and check with your child's doctor for validity, because there are lots of things out there that may not necessarily be helpful. And of course, remember the Autism Society in North Carolina. We have lots of supports that you can use to learn more about autism, and also strategies you can use to help with behavioral issues and sensory and communication needs. So now we're on to our final objective, resources. In the next several slides, I'm going to give you some information that will be helpful to you regardless of where you are age-wise. So the North Carolina Family Navigation Guide, this is a free online guide, and it allows parents to learn more about statewide supports, and it helps them make steps for their child if they're diagnosed with a disability, including autism. So your child may not have autism, they may have another disability, and this is a great resource. Black families and providers accessing services together. This is a statewide support system where providers and our African American families work together to meet the needs of children. This is a UNC Teach Autism project in collaboration with the Autism Society of North Carolina, the Frank Porter Graham Child Development Center, and it's funded by C. Felix Harvey. It helps families begin early intervention by helping them build a team, help them learn about the ages and stages their child will go through, and empowering families to help their child develop the skills to live up to their potential. If you need help with finding a diagnosis, the Autism Society has several supports that we offer that can help. The Find a Diagnosis is a landing page on the ASNC website, and it's got diagnosis information for individuals of all age. If you suspect that you or your loved one has autism spectrum disorder, it contains those diagnostic information from the DSM-5. Autism treatment is also a landing page on the ASNC website, and it discusses current treatments, 28 evidence-based practices, including ABA. Resources for your journey is a landing page, and it's got helpful links. I'm going to show you more about this in a few slides. And then the Autism Society of North Carolina has a wonderful landing page. It has over 50 webinars arranged by the following topics: behavior, school, newly diagnosed, general autism topics, and adulthood. And some of the information is in Spanish as well. So in addition to webinars, we have blogs with autism-related topics and over 70 social narratives in Spanish and English. And a social narrative is basically what you see on your right. It's taking the rules for a situation and making it visual so that a child can understand it. And our social narratives cover things like health and safety, school, friendships, self-care, life changes, and there's also a lot on seasonal-based topics. If you haven't connected with your local autism resource specialist, you can click on the underlined word title, or you can scan the barcode. You can also go to the ASNC website. You can click on Find Help, then click on Talk with a Specialist under Support. There's no charge for their services. They help families and individuals find a variety of resources in their community. They can help you navigate school and community issues, and also just provide a sympathetic ear for anyone who needs advice. Here are helpful resources that can help you understand if your toddler maybe meet the criteria for needing special support to gain age-appropriate skills. I know earlier I talked about the CDC's milestone tracker, which you would look at the second website to get that. Many people don't really remember how old they were when they started talking, or you may not be aware, of the milestones a child should have. So that is a great resource. The beearlync.gov website will connect you to your child's CDSA. If they're under 3, it will allow them to get services such as speech or occupational therapy, play therapy, and no family is turned away because they can't pay. The Autism Society .org is a great website. They have a lot of information. And then, of course, the Autism Society of North Carolina has lots of information as well. These websites are important for people needing a diagnosis. I already showed you the North Carolina Family Navigation Guide. North Carolina is blessed to have the TEACH program. We have regional centers throughout the entire state, and they are kind of the gold standard when it comes to diagnosing autism. The other thing they do is they provide services for people all along of any age and anywhere on the spectrum. So an adult who's mildly impacting can go to TEACH and get some help. Families who have an adult who's severely impacting can go to get help. They have special programs for families with toddlers. So the TEACH program is a great place to check out and get connected with if autism is in your life. There are also a lot of local providers that do diagnosing, and that's where your autism resource specialist can help you. You may be able to find someone to get that diagnosis done more quickly than a year. If your loved one is diagnosed with autism, please know the Autism Society of North Carolina is here to serve you in a variety of ways, regardless of where you live in the state. It's our mission to improve the lives of individuals of all ages across the spectrum living in North Carolina, as well as support their families. And we do this by providing services, as well as educating the community, including families, professionals, legislators, educators, and law enforcement, so that North Carolina can provide its autistic residents with a safe and happy place to live. And unlike many programs, many of our resources at the Autism Society of North Carolina are free. Because you're trying to figure out whether or not autism is part of your life, I really want to show you this landing page on the Autism Society of North Carolina's webpage. Resources for Your Journey is a wonderful section of the website. And so regardless of where you are on that journey, you can click on the descriptors and it will help you starting right where you are to find the resources that you need. Also know if your child has a new diagnosis, the Autism Society's webinar library has a complete section just for families whose children are newly diagnosed. And so once you finish that 4-part series, then you can go and explore other topics in other parts of the library. All of this is free, free for you to use as many times as you need to. You can share it with family members or others that you may need some support from. Thank you again for taking time to watch this webinar. I hope it's given you the necessary information you need to move on in finding a diagnosis and developing your next steps. If autism is part of your life, please know the Autism Society of North Carolina is here to provide you with the information, resources, and support throughout your life.